Trastuzumab is a medication used to treat certain types of breast, stomach, or esophagus cancer. It is specifically used to treat tumors that produce more than the normal amount of a certain substance called HER2 protein. Trastuzumab is a type of medication known as a monoclonal antibody, and it works by slowing or stopping the growth of cancer cells. This medication comes in various forms, such as trastuzumab-anns, trastuzumab-dkst, trastuzumab-dttb, trastuzumab-Pkrb, and trastuzumab-Qyyp, and is usually given as an intravenous solution. It is important to follow the dosage and timing recommended by your healthcare provider for the best results. This medication is administered through a slow injection into a vein by a healthcare professional, typically once a week or once every 3 weeks. The first injection should be given over a period of at least 90 minutes. The dosage of trastuzumab-Qyyp 420 mg intravenous solution depends on various factors, including your medical condition, how you respond to treatment, your weight, and any other medications you may be taking. It's important to inform your doctor and pharmacist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Using this medication regularly will help you get the most benefit from it. You can mark the days on your calendar when you need to receive the medication to help you remember. Your doctor may also prescribe other medications, such as acetaminophen and diphenhydramine, for you to take before each dose to help prevent serious side effects. It's important to follow your doctor's directions carefully. Side effects of trastuzumab-Qyyp 420 mg intravenous solution can include redness or irritation at the injection site, diarrhea, muscle or joint pain, stomach or abdominal pain, headache, trouble sleeping, nausea, vomiting, mouth sores, and loss of appetite. Some people may experience severe nausea and vomiting, and your doctor may prescribe medication to help with this. If you experience any of these side effects, let your doctor know. Remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Some serious side effects to watch out for include symptoms of heart failure, bone pain, numbness or tingling, changes in mood, fast or irregular heartbeat, and easy bruising or bleeding. This medication can also lower your ability to fight infections, so be sure to report any signs of infection to your doctor right away, such as a sore throat that doesn't go away, fever, chills, or cough. Although it's rare, some people may experience a severe allergic reaction to this drug, so seek medical help immediately if you notice any signs of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor or pharmacist. Remember, if you're in the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. Trastuzumab-Qyyp 420 mg intravenous solution can potentially lead to serious heart problems, including heart failure, especially when used in conjunction with other medications like doxorubicin. Your doctor may discontinue the treatment if heart problems arise. Reactions to the injection may occur, typically during or within 24 hours of the dose. Close monitoring can help reduce the risk. Inform your healthcare provider immediately if you experience symptoms such as fever, chills, flushing, headache, nausea/vomiting, trouble breathing, dizziness, weakness, or feeling faint. Your doctor may adjust the injection speed or temporarily halt the treatment. It is important to note that trastuzumab-Qyyp 420 mg intravenous solution can cause serious and potentially fatal harm to an unborn baby if used during pregnancy. Therefore, it is crucial to discuss reliable forms of birth control with your doctor before starting the treatment. Before taking trastuzumab, make sure to inform your doctor if you have any allergies, especially to any trastuzumab products or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Also, share your medical history with your doctor, especially if you have a current or recent infection, heart disease, lung problems, or have undergone previous cancer treatments. Trastuzumab may increase your risk of getting infections or worsen current infections, so try to avoid contact with anyone who has a contagious infection. It's important to talk to your doctor if you have been exposed to an infection. Be cautious around sharp objects and avoid activities that could lead to injury to lower the risk of getting cuts or bruises while taking this medication. You may feel dizzy while using this medication, so it's important to avoid alcohol or marijuana, as they can increase dizziness. Avoid driving or operating heavy machinery until you know how this medication affects you. Also, make sure to discuss marijuana use with your doctor. If you are planning to have surgery, inform your doctor about all the medications you are currently taking. It's important to discuss pregnancy and birth control options with your doctor before starting this medication, as it may harm an unborn baby. If you become pregnant while using trastuzumab, talk to your doctor right away about the risks and benefits of the medication. Additionally, it is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding while using this medication and for 7 months after stopping treatment. When taking Trastuzumab-Qyyp 420 mg intravenous solution, it's important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Your doctor should be informed of all the products you use, including prescription and non-prescription drugs, as well as herbal products. It's crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. It's also important to note that Trastuzumab-Qyyp is very similar to other medications such as trastuzumab-deruxtecan, trastuzumab-emtansine, and trastuzumab hyaluronidase. Therefore, it's essential to avoid using these products while taking Trastuzumab-Qyyp to ensure the safety and effectiveness of the treatment. Always consult your doctor for the best timing and daily dosage of this medication for optimal results. If someone has taken too much Trastuzumab-Qyyp 420 mg intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911. Alternatively, you can contact a poison control center for assistance. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Before starting to use Trastuzumab-Qyyp 420 mg intravenous solution, it's important to undergo certain medical tests like heart exams and complete blood count. These tests should also be continued while using the medication. Make sure to attend all medical and lab appointments as advised by your healthcare provider. Make sure to take each dose of Trastuzumab-Qyyp 420 mg intravenous solution as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately to rearrange a new dosing schedule. This medication, Trastuzumab-Qyyp 420 mg intravenous solution, is administered in a medical setting such as a hospital or clinic and is not intended for home storage. It is used to treat certain types of breast cancer and stomach cancer. The dosage and frequency of administration will be determined by your healthcare provider based on your specific condition. It is important to follow their instructions carefully. Be sure to discuss any concerns or questions with your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.